So this is being broadcast on Facebook as well, and we will be taking questions. So thank you, everyone. First and foremost, I would like to thank Ms. Lili-Anna Peresa, who is the General Director of United Way, who is with us today. Very happy to be able to announce this together. And yes, we're repeating it. This is a difficult situation we very often have. Worrisome news, even if it's just the number of cases of infected people that is increasing. But we found it important to also share good news, the things that are being done through solidarity, through generosity. This is what we are going to be talking about today. So we know that, of course, we often have to. There's a lot of people who work, who put a lot of energy to help the population to get through these crisis moments. We're talking about support staff. We're talking about the healthcare staff in the large healthcare system family. And I'm also thinking about our workers, and I take this opportunity to thank them, the city workers. We're seeing all sorts of images. They continue working by respecting the rules, but they ensure essential services. So thank you to all of you. There are also community organizations that play a very important role in our social network, in our society, and that are helping out the government organizations as well as municipal organizations. And at a time such as these, they, of course, are also destabilized. You'll recall last week the city of Montreal decided to help out Moisson Montréal, amongst others, by asking blue-collar workers to help prepare the baskets and take care of the foodstuff, because the number of volunteers in certain organizations has decreased drastically, amongst other reasons, because as we know, there's a lot of elderly who contribute to doing volunteer work in our organization. So either for reasons of human resources or other reasons that are often technical in nature, and I'll give you some examples later, we know that it's not easy for community organizations. So today, what we've decided to do is to really pull our efforts together with Centraide to really support United Way, to really allow the organization to respond to basic needs. We're talking here about foodstuff distribution, preparation and distribution of meals. And I would also like to mention there's a lot of needs in terms of just listening. You know, there is psychological distress, anxiety is on the rise. So all of those services referring more vulnerable people, more isolated people are very important. Everything having to do with psychological support as well, or rather technical support. People who are giving services as far as mental health is concerned. So what kind of technological support can be offered to those organizations so that they can do telework? And finally, in the different boroughs of Montreal, neighborhood organizations do in the field work to create awareness in people, amongst them the elderly, who, as we know, are more isolated than ever, for good reasons, but we do want to make sure that they feel supported. So I wanted to give you a few examples of the work that the organizations are doing right now and for whom it is difficult. So we joined United Way of the Greater Montreal area to have an emergency fund. The City of Montreal is going to be contributing $150,000 in order to give as much help as possible. So I asked and I sent messages to all the boroughs asking them whether it was possible for them to contribute to this emergency fund for community organizations. And they really responded. Here we are. Most of them said, we're going to help you out, and I wish to thank them. I mean, you may imagine that normally the mayors would have been with me to present this with me. It's not possible to do so, so I wish to thank them. I'm saying mayors, but it's also all of the elected officials and all the boards who voted in favor of this emergency fund and who put important amounts there. So I was saying $150,000 for the city of Montreal.
Excusez-moi. $150,000 de l'arrondissement.
$150,000 for Ville-Marie. The Ville-Marie borough, $100,000 from Mercier-Hochelaga-Maisonneuve, $100,000 from the Southwest, $100,000 from Ahuntsic-Cartierville, $100,000 from Rosemont-Petite-Patrie, $100,000 from the Plateau, $100,000 from Anjou, and $100,000 from Villeray-Saint-Michel, Parc Extension. to add or added $40,000 from the city of Outremont, $40,000 also from Montreal Nord, Montreal North, $35,000 from Montréal Verdun, and from La Chine. And we'll be able to give you that list for the journalists who are with us in the room. So as you can see, everyone, or almost, has put energy here, and we're happy about this. So if we compile all of this, the total is $1,140,000, which is being added, of course, to what Ms. Peresa is going to be announcing to us, this fundraising for the emergency fund. So I think that it really shows that the boroughs, the elected officials are there. We really want to help locally as well as nationally, because that money is going to allow us to help very local organizations in the boroughs that we name, but also to be able to give more general help in other organizations that have to do with the population as a whole. And where I'm very proud is that we moved quickly, efficiently, and once again, it makes me happy today to be able to remind everyone to the extent to which, elected officials, we are right at the front on all questions. And today, this, we can see, is not an exception. We really are in the front lines. And I want to salute all those people throughout the province that are doing exceptional work. So bravo, everyone. And I think that it really shows the ability of Montreal to mobilize itself to help the most vulnerable among us and to send a clear message. That is to say that normally, but especially in crisis, we can't leave anybody behind. Thank you.
In English, I'm here today to announce that the City of Montreal will be contributing to an emergency fund in partnership with the Centraide du Grand Montréal. We wanted to show Montrealers that boroughs are there to support their local organization, the nonprofit organization that are doing an amazing work in all the time, but especially right now. And for those, it's not always easy to find the human resources or the financials to support their activities. So this emergency fund, the City of Montreal will contribute $150,000. And I did send a message to all the boroughs earlier this week saying, would you like to contribute? Can you contribute? Let's send a very strong message that we're there to support our local organization. And so they answered yes. Most of the boroughs said, we're here to support as well. So Ville-Marie Borough supported, gave an amount of $150,000. And for the next following boroughs I will mention, that I will call, they contributed up to $100,000. So merci Hochelaga Maisonneuve, the Southwest, West, Antique Cartierville, Rosemont La Petite Patrie, Villeray Saint-Michel par extension, le Plateau Mont-Royal et finalement Anjou, une contribution de $100,000 chacun.
A contribution of $100,000 each.
Montréal Nord as well with $40,000, Verdun $35,000, and La Chine $25,000. So the grand total today we're announcing is $1,140,000, which will be added to all the efforts that the Centraide du Grand Montréal is already putting together. And again, this will help for food banks. It will help for organizations that are doing support for people that are dealing with anxiety. It will support organizations that are also fighting the isolation of our elders. We want them to be at home, but there has to be ways for us to connect with them. So I'm very pleased to tell all Montrealers that we are there to support, that the elected officials wants to help. We want to be quick and efficient because ultimately our goal is to not to leave anyone behind. Thank you. And now, I will
now pass the mic to Ms. Peresa to be able to talk to us about the United Way initiatives. Thank you, Madam Mayor. First of all, I wish to thank you personally for this extraordinary gesture, the entire city of Montreal, and I've counted 12 boroughs, as well as the employees, the entire team in the City of Montreal, for this very generous contribution of over $1 million. It is so impressive, this contribution to the Greater Montreal United Way fundraising. And I have to mention that the crisis cell that has been set up by the city is doing extraordinary work to assure the collaboration and coordination together with the CUS networks, public health, with the different neighborhoods and the different actors in the city. We're all there together to find solutions quickly. So our community organization are working very hard and are adapting themselves as usual, very, very quickly, to the very important increase in demand. They have to deal with the new measures of social distancing, which complexify their work tremendously. And with the reduction of their usual volunteers, we know usually it's the elderly who do a lot more volunteer. So now they have to welcome new people who are doing volunteer. And they try as well as possible to maintain the services with the most vulnerable people. So the first priority in the setup of the emergency fund is to ensure the food safety of families, children, elderly, and all the people who are vulnerable. Whether those people have some kind of limit or issue, if they're newly arrived here. So on our entire territory, we want to give them the necessary support so that they be able to get through this crisis. So thanks to the amount now put in the emergency fund, we're going to be able to help community organizations that are at the front lines, not only those that are usually financed by United Way. We are broadening the scope of organizations that we are helping out so that they be able to offer those essential services to the most vulnerable. We have set up a mechanism that is adapted to the situation to be able to increase by 100% the donations that will be given to the emergency fund. And we have given ourselves as an objective to answer community organizations within 48 hours where we've received their request for financial support. So this is a lightened process. We wanted it to be simple so that we could have a quick effect on as many people as possible. We are in constant link with the Greater Montreal Reference Centre, which is the operator of the 211 phone line, which is an organization that is supported by United Way, of course, and the metropolitan area of Montreal. This emergency fund also allows us to increase its ability of action with more staff, but also to give them the necessary equipment to be able to respond to the numerous calls that they have been receiving. They have tripled in the past few days. And so it is primordial for us to be able to support that 211 line throughout this crisis, because vulnerable people, that is where we invite you to call to know which organization is open in your neighborhood, who can help you depending on your needs. But it can also allow us to identify where there's a gap in the services, where are the places or neighborhoods where there's no organization that are in activity that could respond to the needs, and we can adapt ourselves quickly. So we have launched this emergency fund as of last Friday, and we can already tell you that there are many companies and partners who have responded to the call. So apart from the City of Montreal, of course, there's the National Bank, the BMO, Cogeco, Desjardins, Énergir, Hydro-Quebec, Industrielle Alliance, Metro, Power Corporation, Sun Life, Omega, and there's about 15 others with whom we have been having exchanges, private foundations as well, that are naturally very generous. And of course, we are also calling out to the generosity of the public for those who can in a very uncertain context. Those who can be generous, we would invite you to make your donation on the website of United Way, which is centraide-mtl.org, or by using your smartphone and texting 100 and typing the word COVID, which I think we all know how to spell by now. So we estimate that it is together that we'll be able to help those most vulnerable among us to be able to surmount the COVID crisis. Thank you to you all for acting here with heart. We truly are a community that is very tight-knit, and now we have to stand together even more. So, English before the question period.
First, I would really like to thank the Mayor of Montreal, Valérie Plante, the city, la Ville de Montréal, and the city's boroughs and their employees for this very generous contribution of more than $1 million to Centraide of Greater Montreal for the COVID Emergency Fund. The city's crisis cell is doing an extraordinary job with the different networks, might it be the CIUS, the public health authorities, the neighborhood roundtables, and different stakeholders from the community sector. We're all taking action, and we're committed to find solutions very quickly. Our community agencies are working hard, are adapting to the situation, and while applying distancing measures, they have work that is more and more complex, and they have to cope with the fact that they have less volunteers and they have to welcome new volunteers. But as usual, they are proactive and they're there to respond to the needs of the most vulnerable. The number one priority of the emergency fund is to ensure food securities of families, children, seniors, and all vulnerable people, whether they have limitations or are newcomers to our territory, and give them the support they need to get through this crisis. Thanks to the money raised through the emergency fund, we can help frontline agencies, not only those who are usually funded by Centraide, help them to provide essential services to the most vulnerable in our community. We have set up a mechanism specific to the crisis to accelerate the allocation of 100% of the money that we will receive in our emergency fund. So our goal is to respond to community agencies within 48 hours of a request of financial support that we will receive. The process has been streamlined so that we have a quick impact on as many people as possible who will need help. We are also in constant contact with the 211, the Information Referral Center of Greater Montreal, so that we can support the fact that they are receiving more calls right now. It is essential for us to have an adequate 211, and we invite people who are wondering where they can help to call 211. It helps us to define what are the needs, but it also to see that there are no service gaps and that we adjust ourselves to address those gaps as quickly as possible. So since the launch of the fund last Friday, many partners responded, like the City of Montreal, to our request. So the National Bank, BMO, Cogeco, Desjardins, Énergir, Hydro-Quebec, Industrial Alliance, Metro, Power Corporation, Sun Life, Omega, and many others, at least 15 other companies and foundations. We're in conversation with them, and so we'll be able to extend that list shortly. Of course, we're calling upon the public's generosity. So anyone who can generously contribute in these uncertain times can make a donation by going on our website, centraide-mtl.org, or by texting COVID at 8100. It is together that we can help people who are vulnerable. We want to make sure to leave nobody behind, and we are extremely grateful for your generosity and for showing your local love. Merci.
Thank you. We're now going to go to questions for the journalists. Question audible. I'm going to give you an approximative amount because the amounts will be confirmed to us during the week, but we're at least $2 million for the time being, excluding the amount that Madam Mayor just announced to us, because that we learned only a few moments ago ourselves. So as far as I'm concerned, I think that's what it is. Hydro-Quebec said that they would help us out, but we don't have the amount yet. It's many companies that are in the same case, so we'll be confirming the amount later, since Friday. Question is inaudible. Well, these are frontline organizations. We are there to fill the extra needs. So the funding of regular organizations of the Greater Montreal United Way or Public Health, they have all received their usual amounts. So it really is for the increase in demand, the surplus, that we are there to be able to respond to those basic needs. Inaudible question. We did that estimate at a provincial level. There's about 3,200 social community organizations in Quebec, and I would tell you that a third of them are frontline organizations. Our estimate is that we would need 30 million per month to be able to respond to all the needs. So this amount is a first step to be able to respond to the needs in Quebec. Inaudible question. So yes, we have enough staff because you have to have expertise to be able to respond to that kind of need. So yes, it's tripled. We are at over 2,000 calls in the past week. Over 24,000 people who went on the website. 75% of calls come from elderly people. 30% of the calls are for questions of food safety. So every day it increases. And right now, I also wish to ask organization, please tell us whether you are active or closed, partially closed, so that we can guide people to the right places. So please send the information to your volunteer action centers as well as to the 211 line. And so together with the jebénévole.ca site is the place to go make those offerings for volunteers, but also the place where organizations can write up all the needs that they have. Inaudible question? Yes, for all of Quebec, for community organizations. So that is an estimate.
Exact.
Once again, inaudible question. The interpreter does apologize. This is per month, 30 million per month. Well, we've already presented our estimate to the provincial government, and they are analyzing it. We have made many proposals because we have many buildings which are equipped, they're heated and lighted, of course, and that have sanitary units, and that's very important as well. The information that we have, it was for the closure of the Royal Vic, or in general, your question? Well, generally speaking, yes. And in the case of the Royal Vic, it's not so much the closure as the transformation of the Royal Vic in an isolation unit. All the people who were there in the overflow ward are going to be placed elsewhere. So for the women, it's at the YMCA for women downtown. And for the men, the place that was identified was the Guy Favreau Center. And I wish to thank the government, the Canadian government, who helped us at this level to be able to have the installations. So depending on your gender, you go where. What concerns you? Yes, you have. What has to be known is that the homelessness file, globally speaking, is of course a provincial domain. We are there in complementarity, and of course to inform the province of the needs. The information that we have from the CS is that they are collecting the information on the needs of shelters, but we've already identified places. We're ready. The city is ready. I have 4 questions because my colleagues aren't here, so I'll take some of your time. The first, are there any layoffs planned in the city of Montreal? Because certain cities are starting to evaluate that. Is that the case in Montreal? We are not at all in that scenario for the time being. Once again, at the City of Montreal, we were very quick at easing working from home. When I'm saying that the city is a bit slowed down, that's true. We're already preparing projects because the day that we're going to start again, it will be ready. And in the case of people who cannot work from home because of their task definition, we are using those people in different ways, for food banks. Moisson Montreal, those are good examples. And also moving all the transportation of the material from the Royal Vic toward the two places that I just named. That will also be done. There's going to be the help of certain, blue-collar workers while respecting everything that has to do with hygiene and cleanliness and the safety measures. But for the time being, we're not at all into layoffs. Talking about safety, there are firefighters who have been told that they were in contact with people with COVID and to go back to work if they have no symptoms. Is there clear guidelines? Well, generally speaking, if a person has symptoms, they have to go get tested. We know that there is a clinic that just opened downtown. So, of course, right now, in the hierarchy of firefighters, there has to be a clear guideline saying if you have symptoms, you must absolutely go get tested before going back to the firehouse. But if they have no symptoms, but they were in contact with people who had COVID-19, well, in principle, it would be in isolation, but I can get back to you. I'm not saying that there's anything wrong, but I did not get that information. I'll be happy to get back to you with it. We don't want to bring people back who might be in direct contact with people who are contaminated. Everybody has to be confined. That's clear. For me, anyway, it's clear. My colleague Jean-Sébastien would like to know, when you see your city in lockdown, what does it do to you?
I would say more in a slow mode.
I would say more in slowdown than lockdown. What does it do to me? Well, honestly, I am so much in the present moment. We're still always looking for solutions. I rarely let myself be brought down by discouragement or a certain feeling of powerlessness that could affect me. And to go with your previous question, just to know, for example, that a part of, the blue-collar workers, but, the white-collar workers are continuing to work on the projects that are coming up, that we do want to start this summer if everything goes well. So the city is continuing. But, of course, we're going to have to adjust ourselves, and we're going to do that together as quickly and as well as possible. But I have to say that I feel very supported. I often speak with the economic domain, the bigger players who, like me, we've started to think about how we want to relaunch things, how to give a good kickstart to the city once it starts again. Last question. Might the city take incentive measures to help businesses? To help merchants? Well, we already do it through PME Montreal, SME Montreal. You know that we are, for example, all the loans that have been given by, SME Montreal in terms of economic development, we have postponing, taxes and payments of loans. So that for us is good news. And we're working together with the SDCs to identify businesses that might have specific needs. And we also launched a phone line, which is very, very popular. I won't keep it from you. Right now, I'm getting messages, and that line is receiving messages that are heartbreaking because we know that businesses, especially the smaller companies, people put everything into their companies. We are acting in complementarity. Alone, the city cannot save a company. However, if we can, with the different funds that we have set up in complementarity with all the other levels of government, if we can support businesses, we are doing the maximum that we can do. That really is our wish. Question, something to do with crowded buses? Listen, I have to admit to you that this morning I was surprised to see that I saw one image, and I'm not saying that it's not true, but it surprised me because everywhere the buses are empty. So I thought, well, what happened there? I don't know what line it is. I don't know what time it was at. But clearly that's not acceptable. We do not wish for there to be so many people stuck together. The rule is minimum 1 meter, ideally 2. So we're going to go and try to identify what that bus line was. Why was it so popular and at what time was it? At any rate, I invite the population, if you want to take a bus, especially if it's not an emergency, if you're not in a hurry, if there's a lot of people on the bus, I think it might be worth waiting for the next one, especially since the schedules have not been modified. The service remains the same. There's been no change. But I will go try to find out. And of course, it is important that the population respect those rules for the driver, the bus drivers as well, so that there is the necessary distance. But we're going to go find out.
Oui.
Inaudible question. Something about everything being delayed or postponed. How long can the city keep paying its employees? Partial question. Well, you're right. It is possible that we may get to that, but right now it is not the scenario that I am using as the main one. There's a lot of people who are already, on employment insurance. There are companies that can no longer be open. So what I wish is to be able to keep my people, our people, as long as possible. But it has to be done intelligently and it has to be done progressively if we should get to that. But right now, I'm not sending any message to employees of the cities of Montreal that there's going to be layoffs of any kind. But of course, depending on how long it lasts, as you said, if it lasts for many months, of course, we may have to see what kind of plan we'll have to change, but we're not there yet at all. Inaudible question. Well, right now, this is a stoppage of 3 weeks that was asked by the Quebec government in collaboration with public health, of course. We are going to respect that. Of course, I won't keep it from you that we hope to be able to stop that as much as possible so that construction sites can go. The small ones can be delayed. The medium ones have non-negligible impacts, but the big ones, like collective transportation, there's the REM, but there's also, a lot of big construction sites within the STM that are important, not to say vital, for the continuity of the operations and to maximize our deployment plan for public transport. But once again, we're going step by step. There's a moratorium or a stoppage for 3 weeks right now, so we are going to reevaluate later. We reevaluate at every moment, of course, but I do hope that it's not going to last longer. But once again, we have to do it for the common good and public health, so we're going to respect the rules. Well, listen, for 3 weeks, I would say, I would like for everything to open again. I'm thinking about the Réseau Express Vélo, which is one on which we started working already. The work for the STM are really important. There's the blue lines, there's the CRSLB P9, and the garage to have the 300 buses. So once again, we are in a 3-week stoppage. We are really using that calendar, hoping that we can reopen everything later. Same thing for the REM. These are all transportation things that I've been talking about, but there are some that are considered priorities, and they are continuing, like priority of priorities. English questions?
Many Montrealers are very worried about their ability to pay the rent. Both federal and provincial compensation related to COVID-19 do not directly help renters. Is there something the city itself can do besides stopping eviction to help renters specifically?
So this is a question that concerns me and our administration a lot because we know that we want everybody to have a roof. It's one of the the first condition of just to be able to go through this crisis. And so we're talking with the provincial and federal. about it. Those are competencies that belongs mostly to the provincial, but also to the federal. And so I guess, though I have very limited power over that specific question of the rents, how can people will pay the rent, I guess I'm asking landlords to be very open-minded and to be flexible around the rent, especially now that the landlords, they don't have to pay their mortgage. They have like a flexibility now. They can wait longer. So I think it would worth it to make efforts for them to, lower the rent or maybe delay the rent if possible. I cannot give an order on this, but I think it would be a nice gesture for a lot of people that are dealing with a lot of financial insecurity right now.
Gloria Enriquez, is there a plan to get food to kids who are currently at home but usually get their breakfast and lunch at school?
Yes, and I'll let Madame Peresa maybe add to this, but we're also working with Le Clé des Petits Déjeuners that usually covers a lot of the children's need in school, and because we know how important it is for everyone, but we want our kids not to have an empty belly in those very difficult times.
So yes, indeed. Kids are at home, and usually they had their one good meal at school, but families are involved, so we want to make sure that their parents get the right amount of food as well. So the neighborhood tables will play a role in making sure, either through distribution or so on, to better identify and support that. I wanted to come back to the question of the rent, because that's the second question that the 211 is receiving. How is it that I'm going to be able to keep my home? And I just want to I became aware while talking to the federal minister Hussein on Sunday morning that the support, the money that will be coming from the federal government to people who have low incomes will be through the tax return. It's Revenue Canada who has that responsibility. So we have to make sure that people who have low income file their income tax. So we are going to have to accelerate the income tax clinics and do it in I'd say, virtual way. So that is also something that we're working on to the request of the federal government.
Which I believe is actually one of the things that the emergency fund could support some of the local organization that helps low-income family to do their tax return papers. So all connected. Exactly.
de Gazette en français, la mairesse peut-elle nous parler des dernières données?
Can the mayor talk to us about the latest data on the people affected by COVID-19 in Montreal? How is the situation evolving? Well, listen, everything having to do with the numbers of people affected. That is really information that I want to be the public health that will talk about it. It is their domain of expertise. It is their way of calculating, but also to be able to explain and give a context. So I won't be able to go further at that level, but of course, as all Quebecers, the fact that the number has tripled, of course, it's worrisome. At the same time, since many of us were expecting it, since the number of tests increased so much, we're testing more people necessarily, there is an increase in cases. But what I can say at the end of the day is that this emphasizes the importance of following guidelines. No gatherings. Stay home as much as possible. If you go to the groceries, you go one person. You're not going to go as a family to choose your favorite cereal. You make a list, one person goes there, and that's it. You wash your hands. You keep distance with other people. And if you have any symptoms, the number of clinics is improving, including the one at the Quartier des Spectacles. Go there, and of course, the telephone line that has been shared many times. One last question.
Toronto issued state of emergency. What is criteria from Montreal to do the same?
So we're following our situation very closely, and let's not forget that we're working very, very closely with both the public health authority, the regional one, and also the national one, working with the government as well. And so before deciding to go into a state of emergency, it's something we will make the decision together. At this point, we don't feel like this is the step to do, mostly because we have enough of the power to do what's necessary. But again, if we feel like we need to move forward in a different way, we will. But right now, let's not forget that the City of Montreal has the intervention center where you have the police office, the service de police, service des incendies, urgence santé, all the strategic people within the City of Montreal are in one, mostly in one physical place. It's quite big, or through the phone, but so we are able to coordinate. So we're not in a place where we're gonna call for the state of emergency, and but if we have to, we will.
Merci tout le monde.
Merci.
Thank you, everyone.
Et je pense qu'on